I'm Dr. Simon Chan. I'm a physician. I'm an internist and also a gastroenterologist. That means that I take care of patients who are adults, and I also take care of patients who might have stomach, colon, liver, pancreas diseases. I'm also a college counselor, meaning that besides seeing patients, I spend time in helping young students to go to colleges, as well as college students go to professional schools and graduate schools. Today, I have such a pleasure to talk about a career called physician assistants, abbreviated as PAs, throughout my talk. This profession has been around since the 1960s. I'm very proud to be the person able to introduce and maybe reinforce the existence and also the value of this particular profession, PA. I went to Princeton. I also went to Mount Sinai Medical School. Thereafter, while working full-time, I also went to executive programs, weekend programs, to study MBA, business, MPH, management, MSOD, psychology, MDR, which is a law degree. I also went to Oxford University to study something called evidence-based practice of medicine. Through all these education, I was able to appreciate the profession of medicine, at the same time able to gather enough experience to help my own students, the younger ones, to apply to college and at the same time apply, or later on apply to professional schools and graduate schools. So let's start talking about PA. What is a physician assistant? PAs are actually healthcare providers who help and works with medical doctors. They can perform essentially the exact same function as MDs, medical doctors, except that at times they would require medical doctors' supervision. For example, how to write medications, perform procedures, perform physical examinations, assist in surgeries, etc., etc. So PA's typical responsibility include they do so-called H&Ps, history and physicals. They act as a first assist in the operating room. They will assist in surgery and procedures. They help with diagnosis of patients' diseases and write patients' medical treatment plans as well as medications. And of course, they will provide medication scripts. They will give health education and counseling. They will order and interpret laboratory values as well as radiological diagnostic tests. So in short, PAs do exactly what an MD does, except that PAs do not require the same number of years of education like a medical doctor, MD, and at the same time, they perform some services and procedures with the supervision of a medical doctor. So about 2/3 of PAs are actually female, very interesting phenomenon. 40% of them actually in primary care, and 24% of them actually specialize in family practice. That means they see patients of all ages. And 17% of them actually in internal medicine, means they see only adult patients, and about 20% of them actually are in surgery, and about 10% of them actually are in emergency rooms. So they perform a wide variety of functions. So therefore, you should ask, or many people should ask, why should I become a PA? Why can't I become a medical doctor? Of course, I already mentioned the number of years of training for MD is so much longer than a PA. And the profession of PAs actually is created many years ago. The first actually PA program was at Duke University at that time, was mainly for the purpose of increasing the number of primary care providers to help with the nation's shortage of primary care to patients. So therefore, why should I become a PA? The opportunity to work with an MD, medical doctor, opportunity to work in clinics and operating rooms, and opportunities to have hands-on services to patients as well in surgery, strong interest to learn medicine and surgery, of course. But again, the key is that you don't need the same number of many long years of medical schools and residency training like a medical doctor. However, we should also understand the difference between an NP, nurse practitioner, and a PA. PAs are trained under the medical model. That means disease center as a focus. PAs are not trained in only one specific area. While nurse practitioners, NPs, they are trained in a nursing model, so therefore mainly involved with biopsychosocial centered focus, and NPs are usually trained in one specific area, for example, family medicine, acute care, etc. So there's slight difference in what they do for the society. PA's promising job outlook. I'm going to present quite a bit of numbers. You don't have to memorize anything. I just want to demonstrate that PAs, they do have a role in the society with a very strong reimbursement that is tacked onto it. Physician assistant, they will fill the shortage of doctor shortage by the year 2036. We will have approximately 86,000 doctors shortage. And we will have about 48,000 primary care family doctor shortage at about the same time. So PAs, physician assistant, will fill, hopefully, that shortage, which is ultimately and essentially incredibly important to the society. The 7 best healthcare jobs in the United States in present day, 2024, will be nurse practitioner, physician assistant as number 1 and number 2, highly sought after, among many other healthcare professions, mid-level providers, as well as medical people. PAs are in high demand. They have this particular opening of approximately 12,000 per year, which has a growth projected as 31% from year 2020 to year 2030. PAs can work in many different workplaces, including hospitals, but most of them, 50-some% of them, actually work in physician's office, primary care offices. And PAs, about 20% of them actually in primary care, and many of them actually is internal medicine, also counted as primary care and some subspecialties, and many of them actually is in emergency medicine. PAs are in high demand. By 2022, the state of California is ranked number 1 in the high demand of employment for PAs. Most PA graduates will get 2 to 3 job offerings by the time they graduate within 2 months. That is a very outstanding achievement. I doubt too many professions will be exactly like that, probably except maybe nurses, maybe except medical doctors, MDs. PAs are in high demand. In California, it's been ranked as number 2 that has the highest pay level for PAs. Number 1 state was actually Washington State. PAs' annual salary actually is about 45% higher than nurses, RNs, and about 1% higher, essentially the same as NPs, nurse practitioners. Again, PAs can work in many different locations and settings, but most of them, 52% of them, actually in physicians' offices. So number 1, 2, 3, 4, 5 work location for PAs would be physician offices, hospitals, surgical hospitals, medical hospitals, outpatient centers like urgent cares, college, universities, professional schools, as well as other healthcare providers' offices. Depends on the PA's level of experience. When it first came out, of course, the salary is not that high yet, but after about 10 to 15 years experience, in the US, a PA can make up to about $135,000 per year, and in California can be as high as $162,000 per year. That's a very high salary. For the last 5 years, on the average, actually, in general, there are about 2 to 3% growth of salary for PAs, and in the next 5 years, all the way up to 2025, same thing, approximately 2 to 3% salary growth per year. Not only catching up for society's requirement, also catching up, I'm sure, for a PA's family's income need. Comparing to all other professions, let's say bankers, or other professions, the salary of PAs actually is more than twice as all other professions on the average. So that is a good 100-some% higher salary for PA than other professions on the average. Of course, a PA cannot make as much money as a physician, but PA actually can have a much higher salary than a nurse midwife, nurse practitioner, a physical therapist, an audiologist, etc., etc., etc. And the top 5 or the highest paid subspecialty for PAs will be cardiology PA, neurosurgery PA, dermatology PA, pediatric neurosurgery PA, and also thoracic surgery PA. Of course, these need to be learned on the job with probably more than a few more years of subspecialty training. California actually will be among the top 10 highest paid states for PAs. Alaska actually is number 1. And the top 10 highest paid city, out of top 10, actually 4 of them are in California: Salinas, Yuba City, Santa Rosa, and San Jose, and Santa Clara. And the top 16 states that employ the most number of PAs will be New York, California as number 2. So the job openings for PAs is very promising. Again, I mentioned already, approximately 12,000 new jobs openings every single year. And almost 1/3 of these will be new job openings because of need. And approximately 2/3 will be left vacancies because other PAs or older PAs already left the job by retirement or move out or left their positions. And the top 16 states that have the highest job opening for PAs, again, New York number 1, California number 2. The job outlooks for PAs is extremely good because there's such a shortage of primary care physicians, including MDs, and the desire for more cost-effective, not just lower cost, but cost-effective healthcare delivery is definitely needed by the nation. And the baby boomers are actually getting older. So for the 10 years to come to year 2030, there are at least 40,000 jobs opening. That's a good 31% growth. And the top 16 states that have the highest job outlook for PAs, California actually ranked number 12. And again, the number 1 is Arizona, Colorado, and all that. How to become a PA? Let's talk about education. After we know about the job outlook, the promising positions that will be open, to become a PA, you must have a bachelor's degree, just like become a medical doctor or other graduate degrees. You must complete quite a bit of science courses to become a PA. And most particularly, you need 1,000 hours of healthcare experiences and patient care experiences. Healthcare experiences are not directly responsible for patient care, and patient care experiences will be directly linked to a patient's well-being. Application, you will use something called CASPA, C-A-S-P-A, and include your transcript, your recommendation letter, usually 3 of them, and your list of 1,000 hours of experiences in healthcare and patient care, and also a personal statement of approximately 5,000 characters, which is a very tough essay to write because 5,000 characters is approximately 800 words, and you cannot only just talk about yourself, you need to talk about your future aspiration and your commitment to the society as a PA. Interview is almost universally required. So preparation for interview is very, very ultimate. And after approximately 2 full years of full-time study, you will be a PA with a Master of Science degree. And by that time, you probably would have a 2,000 hours of clinical rotation. You know how to take care of patients. Then you can take the PANCE exam, the Physician Assistant National Certifying Examination, which has 5 sessions of 60 questions, total of 300 questions in 5 hours. After you pass, of course, you can be a PA. You have a license to practice exactly doing the same duties under the supervision of a medical doctor. And every 2 years, you have to have 100 hours of CME, continued medical education hours, and you also need to pass a recertification exam every 10 years. This is a typical calendar by CASPER. Essentially, the season usually opens in April. That means April 1st, you better have all your requirements and your PA education, everything completed so that you can fill out the application and apply as early as you can to PA schools. Pre-medical PA education. There are total about 300 PA schools in the United States. We only have approximately 150 medical schools in the United States. On the contrary, out of 300, 173 PA schools that are so-called accredited by the Accreditation Review Commission on Education for the Physician Assistant. Only just one state, New York, they already have 42 PA schools. Pennsylvania, 37, California, also a lot, 29 PA schools. And by the year of 2021, a few years ago, there were 158,000 certified PAs. And thank you, really. These PAs are really helping the primary care fields in medicine, medical care delivery. 10 best PA schools in California: USC, Stanford, Western, Touro, Chapman, UC Davis, UOP, Southern California Health Sciences, Samuel Merritt in Oakland, and Loma Linda in Riverside. 20 best PA schools, there are 2 California schools. One is Stanford, the other one is Touro. And out of the 20 best PA schools, actually we do have big name schools like Duke, which was the original #1 PA school in the United States. Then we have Baylor, University of Iowa, Emory, and also number 10 is Stanford University. Stanford admission rate is very low, only about 2%, and most PA schools, all the way up to the top 20, they only admit anywhere between 3% to about 8% of all candidates. Average GPA, approximately 3.5, so therefore cannot be so low. Except certain state PA schools, they will accept as low as 2.5, but very hard to find, very hard to find. Comparing PA and MD preparation, bachelor's degree is a must. MCAT, MCAT, only for MD schools. GRE will be preferred for PA, but not for MD, of course. Essay writing, yes, yes. Interview, perhaps for PA school, usually is a must for MD schools. Clinical experience, 1,000 hours for PA, of course, yes for MD. Laboratory experience, not required for PA, but definitely required for MD's candidates. Schooling, PA school is only 2 years, MD school is 4 years postgraduate training. PA may be 1 year, or you can skip it even. MD must have 3 to 4 years of postgraduate training called residency. Subspecialization, PA is on-the-job training. For MD is a fellowship reapplication to a specific program in a university. CME, 100 hours every 2 years for PA, 50 hours for every 2 years for MDs, recertification every 10 years for PA, 5 to 10 years for MDs. Independent practice, it's been asked about, and also I think will be essentially certified that PA in California can open their own medical practice, their own medical office. MDs, of course, they can. The typical PA student, average age is 25 to 28. Already mentioned, GPA is a 3.5, cannot be too low. About 71% are female, 8% have military experiences where they were previously in military, Navy, Army, etc. 1/3 of them are already married, 79% are usually Caucasian, 50% had a bachelor's degree, usually in biology, 79% have worked in healthcare businesses before, 27% of 1/3 actually had at least 1 year of healthcare work experience before they apply. 70% of them were EMTs, emergency medical technicians. 18% were MAs, medical assistants. 40% applied to only 1 PA school. 31% applied to more than 4 PA schools. And 83%, actually it's a big number, were accepted to at least 1 PA program on the first application round. So it's very promising. If you are really committed to become a PA, you will be able to become a PA. 44% will work in primary care, 37% will work in emergency, and 33% will be in surgery specialties. And I always advise my students, you must get your healthcare experiences and your patient care experiences early so you can shadow a medical doctor, you can shadow a PA, you can work in a clinic setting as a medical scribe, you record medical charts. You volunteer in hospitals and nursing homes, and you join your university pre-PA club if possible. And I always recommend them they should take an EMT certificate. They should also take first aid or CPR courses, or take at least how to draw blood phlebotomy course. My advice for my students to be successfully get into a PA school winning admission strategy. This is for MD, not for PA. Medical doctors, pre-PA, pre-MD experience must have clinical, they must have laboratory research experience, and they must be expert in certain diseases. But for PA, you don't need that. You only need your significant amount of clinical services, experiences, but at the same time, you must have your personal commitment. In other words, don't ever sound like a dropout or failed MD candidate, because you are interested in PA profession, not because you cannot become an MD. At the same time, you must be able to talk about and delineate your contribution to society, meaning that most PAs, more than 50% of them actually will become practitioners in primary care, family practice setting, and that will be your contribution. Of course, some PA will become surgical assistants, they will work in the emergency room, etc. Those are all expected. Application essay, extremely important. Do not start to write about your childhood story. Never sound like a failed pre-medical student. Don't start a story about other professions that you cannot get in, like MD or PhD in something else. Focus all on the PA profession, which is mainly primary care. You must have a heart, empathy. You must be able to contribute as a PA to society, and in your essay, you must have a clear theme, a clear points. Successful acceptance to PA school, first is your GPA, hopefully approximately 3.5. Take your GRE early. This is your responsibility, students. My help to you would be to help you to craft and to find the clinical service experiences, patient care experiences, and clinical patient experiences. Your personal commitment need to be incredibly clear, and your healthcare contribution to the society need to be very clear. This will be my contribution and my counseling for you. And at the same time, your essays and your interview, I would definitely be able to help you to make that steps successful. I'm very fortunate. In my last 18 years as a college consultant, I am also a career consultant, education consultant, as well as an application consultant. So therefore, all three joining together, I have been very successful in helping my students able to get into the schools of their choice, education of their choice, as well as the career of their choice. I'm Dr. Simon Chan. I have been a physician for the good part of my life. More than 20 years in gastroenterology, treating stomach diseases, colon diseases, liver diseases, and pancreas diseases. I've also been a college counselor for the last 20 years, helping young students to go to their dream schools, dream high schools, dream universities, and Ivy League schools. Now, I'm going to take my time to explain in this program more and more of how students actually can able to go from college to professional schools, and maybe even mid-career change from their own career to another healthcare professions. For PA students, I have at least 3 different types. The first type, of course, mostly are students from college. They have developed their interest in healthcare. They gathered their 1,000 hours. They got their 3.5 GPA. They took their GRE, and now they have the application ready. And they're able to provide their commitment as well as their contribution to society and their clinical services to justify and document the clinical competency to be a PA or an assistant to the medical doctors. But I also see some career change students. Now they already have a career, but after they get married or so, have a family now, they want a higher societal status, they want a higher salary. So PA profession also become their target. I have also seen the third type of students. These are healthcare professionals like medical doctors from their original countries like China, Hong Kong, Taiwan, etc. Now, They're here in the United States, but they don't want to spend the time to accrue their experiences because they may not need it. However, most importantly, they may not want the 7 years of clinical training and medical school training again and again. So now they want to go into the PA profession. I strongly recommend these students because you already have your professional clinical experience. Now you just need a routine. Now you just need a path to utilize those clinical skills onto helping the United States on primary care, on physician shortage. These are the students I strongly recommend that you should look into this PA profession. Pre-PA is a particular preparation step. As a PA is a particular professional commitment. It doesn't matter where you come from. It doesn't matter how you came from. It doesn't matter how you are able to conquer the many difficulties and challenges. My students, I'm proud to say, they all have 100% admission success. Doesn't matter what they want. At the end of the day, it's about a MD degree, a DO degree, a PA degree, a DDS, a DVM, an OD, or combined BSMD or BS-DDS. That means that it doesn't matter whether they want to be a medical doctor, a PA, a dentist, veterinarian, optometrist, or eventually, after many years of preparation, to go to a combined program for medical and dental career. My students, after very careful of preparation, after very careful execution of the application, they all have 100% admission success. The PA program season is starting in April of every year. Now's the time. If you are really serious about PA, please consider the profession. I have presented to you many data and career outlook. I have presented to you the many steps in becoming a PA. I certainly hope that you will be able to capture the opportunity. April is the time. Be the first one to submit the application. Don't linger on, don't delay. I wish you all the success.